Promotion Directorate. We called this press briefing this morning to brief you about the COVID-19 vaccination campaign that the Ministry of Health through EPI is about to conduct coming the 1st of March to the 10th. So we are welcoming all of you to the Public Health Operational Center here in Kotu, and we are delighted to receive you. So here on my immediate right is Mr. Sidat Fofana, who is the head or director for the EPI, which is the expanded program on immunization. And after him, on my far right, you have the deputy director of health promotion and education, Mr. Sanjali Trawale. So, and we also join with our WHO technical assistant, who is also working with us. And you have Mbayang, the EPI communication officer. And I myself am Jibril Gandobalde, the senior health communication officer for the Directorate of Health Promotion and Education. And we are here joined by the media to sensitize and to orient you on the role of the media in our quest to achieve at least 70% of our targeted population to be vaccinated against COVID-19. As we all know, the pandemic is not yet declared over or finished. So, and then as a country, our immunization coverage is not that much impressive. And the Ministry, NEPI, and Directorate of Health Promotion and Education, through the support of WHO, UNICEF, and other partners, are embarking on another campaign to boost the coverage for the COVID-19 vaccination, which we are to start come beginning of this month, March. So we will be targeting from ages from 12 years and above, because as we all know in the country, we now have 3 vaccines that we are giving out to the public. And then these vaccines are Sinopharm, which is the Chinese vaccine. And we also have the Johnson & Johnson, which is the American vaccine. And we also have the Pfizer vaccine. And this is the vaccine which can be given to kids that are from the age of 12 years and above. So in this press briefing, we will be highlighting on the progress made as far as the vaccination coverage is concerned. And we will be also highlighting the role of the media, which is very, very crucial in trying to improve or increase the coverage as a country as far as the COVID-19 vaccine is concerned. As we all know, we are targeting to vaccinate 70% of the population. And as we stand now, we only have 20% of our population which has been fully vaccinated. And as it stands also, we all know the pandemic have not been declared over in the Gambia, nor have it been declared by WHO over throughout the world. So that being the case, that is why the Ministry, through EPI, is using all strategies to improve this vaccination coverage, which is the COVID-19 pandemic. And we have been seeing series of strains coming up since the beginning of the pandemic, and now we don't want to be caught in another surprise, because the COVID-19 pandemic itself came as a surprise to the whole world. And we should be prepared for the next wave or for the next emergency that this COVID-19 pandemic will come along with. So without wasting much of your time, our presenters will take you through in detail of all the presentations that we have for you with regards to the role of the media, with regards to our coverage as a country, with regards to the challenges and with regards to the strategies that we are using or are going to use during this upcoming campaign to ensure that we reach the unreachable, we reach especially those who are targeted for vaccination, because as a country, we have series of target groups that were mandated to be vaccinated, but still among those targeted groups, there are certain important groups which have a very low coverage as far as their vaccination status is concerned. So thank you for coming and welcome to the Ministry of Health, that is Public Health Operations Center here in Kotu. And Mr. Sanjali will give us a welcoming remark, then Siddharth will come, that is the head of the EPI, to take us through.
As you know, we've been convening this kind of meeting on several occasions, not only for COVID-19, but for any major vaccination program that is being conducted in this country. And we've realized how much you've contributed to achievement of such campaign. So similarly, we expect you to continue with that effort. So we thank you very much for that. The reason why we are gathered here is for you to disseminate the messages that we are going to present here to reach to everybody that is going to benefit for this campaign. So the messages will be delivered, and they will be very simple and very convincing. So we expect you to deliver, to disseminate this message to wider population. As we indicated earlier, these vaccines have been proven to be safe and effective. And it's important for people to take up this vaccine because the benefit is obvious. If you take up the vaccine, the tendency of catching the disease is very minimal as compared to somebody who has not get the jab. So we want to minimize that risk. So I think by now it's a common understanding that because this is not the first time, we conducted the last round, and it has never been reported that somebody developed a very serious side effect or adverse event. So having said that, I think it is proven in this country that this vaccine has been safe, and also to add that it's effective because we are seeing the hospitalization rate reduced. So meaning that it's proven to be effective. So this is the main reason why we are inviting here. As I said, just for you to disseminate the messages that we are going to present here to share with you. So having said that, I will now welcome you officially, and also to thank you. You've been doing great work, and we've been appreciating, and we will continue to appreciate that. We acknowledge that, and we appreciate it. So we thank you very much for coming over again. And as I said, we expect that this message that we are going to present will be reached to every part of this country. And we will urge not only to deliver the message, but try as much as possible, any means of convincing people to take up this vaccine. The vaccine is very important. And it's even a requirement, like traveling to some countries is a requirement. So the benefit is not only to have minimal risk of catching the disease, but also to facilitate your movement to other parts of this world. So having said that, I want to welcome all of you, and I do hope that you will be able to reach, everybody will be reached through your effort. Because you will disseminate the messages that we are going to share with you. I thank you very much for contributing to our work, and we look forward working with you. So thank you very much.
Of health, because for us, we are very thin, especially when you come to information spreading. we are very weak. We have an arm that does that, but definitely they are thin on the ground. So without you, we cannot reach every corner of the country. So with your support, we are always, confident that whatever we deliver, definitely we will be taken to the beneficiaries. I want to welcome all my colleagues here, the Deputy Director, Health Promotion, and we have, if you look at us here, you have a host of people that you may not be very familiar with. These are the people that are provided by our support, our partners, to come and help us support, make sure that we deliver COVID-19 to the rest of the population. So that goes to tell you that this is a very important endeavor that governments, not only Gambia, all the governments are doing. Relaxation of the COVID rules doesn't mean that COVID is gone. COVID is not going now. It's between us. It will going to continue to be with us, maybe for good. So there is no other way that we protect ourselves apart from vaccination. That's the most effective way of preventing one from getting severe form, hospitalization, and dying from COVID-19 disease. That's the only way. And as a country so far, what's important, as this man has been, Gando has been lamenting, COVID is beyond denial now. There's nobody who is denying. With all the false rumors that have been driving all along, where are they? They all die. So the truth will always remain. So I think that's important. We have that at the back of our mind. The only way, as I said, to protect oneself is to make sure that we vaccinate 70% of the population, as is rightly said. So far, we have vaccinated only 18%. These people, the organization they are working for, brought in millions of dollars, millions. World Bank, WHO, UNICEF, IOM, and now NGOs are also joining us this round because it's a concern. NGOs are really development-oriented. You cannot develop the people when they are getting disease and they are dying from it. So that's why this time around, they are joining us. Government is very concerned, and the minister is very concerned, that still now Gambia, we have not reached even 50% of the population for vaccination. This is a risk. And the disease is not going. He was just talking about new variants. Possibility of new variants are coming. So if you are not protected from the old ones, see, and when you have an outbreak of a new variant, that can be catastrophic. A small population like the Gambia, 2 million population, where this man is coming from with the blue hat, one village is more than the population of the Gambia. If those people manage to vaccinate, more than 50% of the population, why are we waiting for? That's why government and partners are still continuing. We ran out of Pfizer vaccine, but over the past 3 days, we have about 3-4 shipments, and more are coming. If it's not important, they will not bother themselves. They will fold their hands and keep their money. Yeah? But now they see that still now this is something that is a problem globally. So the only way to escape from the problem is to make sure that you vaccinate your people. That's why we are here to make sure that the people understand this. Partners have given us money, government has given us money, health workers are ready to deliver the vaccine. And I also know that you people are already set to spread the gospel to the population, to realize that there is a problem in this small country, coupled with all other social problems, but this is one of the most important that government is very concerned about, that the minister is concerned about. Some time ago, he took us around some countries in Africa just to go and see how those people are doing with their vaccination, so that we also come and try to do that in this country. So there is no escape, there is no shortcut, we will have to vaccinate. There are many people in this country who are living with diabetes. Even among us here, if you test us, 1 or 2 or 3 or 4 people will have either diabetes or hypertension. It's a major problem in this country. And this disease don't go hand in hand with COVID. If you get these things, or one of these things, you get COVID-19, your likelihood of dying of that disease is very high. So they are at a very high risk population, and a very high risk of catching COVID-19. We have a lot of elderly people here. We have some people who are living with 3 conditions together. So let's try to do something to help these people understand that this is important. Yes, God, when you die, when your time comes, you die. But definitely, prevention, as they say, is cheaper, and is better. And there are means that can help us protect ourselves. We need these elderly people among us. We need them. If I have a father now who will be able to tell me, good morning, do this, do this, do this. That's myself, although I'm not that old, that young, but definitely we need these people around us for source of wisdom, advice, and to keep our families together. Even that alone makes it very important. Economically, even young people are dying of COVID-19 in this country. So it's the economic fabric that is at risk. That is why no government is going to sit on their laurels, to fold their hands and say, this is not important. Governments, anywhere you see them, they are very concerned. And that is very important. That is very important. We have the largest region in this country, Western one and Western region, where the coverage is very low. This is a big concern. This is where you have about 60% of the population, the cream of the society, the teachers, the doctors, the nurses, the journalists, the media houses, you name it. So if that place, in those places you have very low coverage, then that's a big concern for the minister. It's very, very much concerned that we must do anything possible to make sure that coverage in Western 1 and Western 2 definitely are improved significantly. That way we'll be comfortable. 60% of the population, yeah, we are very. So, as I said, from last 2 months we have about 200 deaths. 200,000 people died, and most of them in Africa. In Africa. So that goes to tell you the veracity of the problem we have at hand. COVID is not gone; it's not going. The only way we can protect ourselves is to make sure that we vaccinate. We vaccinate our family. We convince them. Sometimes, if you have this vaccine, your protection level, the more you go, the more it comes down. So there will be a need for people to take their booster. So vaccine is not a problem now. We have a lot of vaccine. As I said, health workers are ready for the task. Now is for us to spread the gospel, to let the people know that this is something that is here to stay. Let us protect ourselves. Let us prevent our families. Especially those of us who are going, like you and I, are very in the high risk group. How many of us are in contact with each other here? Almost close to 50, 60. So spreading disease is very, very fast. If you look at public health measures, it's very, very fast. So I want to take this opportunity to thank all of you this morning for leaving your press houses just to come on and share with us what the little we have about the situation of COVID-19 globally is terrible, and Africa is bad. Gambia is also not good. So it's our responsibility collectively to make sure that we push. It's not easy. Health workers are fatigued, but definitely the health workers in the country are ready. They are very strong to make sure that at least when you are doing something for your country, sometimes that alone will give you the zeal, to go extra mile, and they are ready to do that. And as I said, the minister is always knocking at our doors. Please, 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 let's wake up. Let's make sure that we save this country. It is not easy. These people have been here for 2-3 years now, just to make sure that we push up. So 18 out of 70% is very small. So that's the situation. It's not good. The situation is not very good. So we can push it. We protect this country. I think that's it. The relaxation of the rules doesn't mean that COVID is gone. It doesn't mean COVID is gone. Please, as he really said, some countries still now you cannot go. They are very protective to their people, the population, because they know the people are the might of a country. So that's why some of them are very strong with trying to put up measures to make sure that these countries where the coverage is not good, don't always go and enter in their country like this. You must be vaccinated for some of them to go. So on that note, I want to take this opportunity definitely to thank you once again, the Health Promotion Unit, and all the vulnerable consultants here from UNICEF, from WHO, and through them I want to extend my heartfelt gratitude to their organizations that brought them here, UNICEF, WHO, to come and help us. They have the technical know-how, and even our brother here from Kiang, is working. He's been hired by WHO to make sure that they come and push us, so that we are able to do the job. So when all this support are there for us, there is no cause that why we should relax and don't do the job. So on that short note, I want to thank you all of you, on behalf of the Minister of Health, like Dr. Lamin Samate, and all the senior staff of the Minister of Health. Some of them would have been with us here, but there is another important meeting. That is why they could not be here with us. So, but through them, I thank you, all of you.
Of 3.0% of the pandemic. And notwithstanding, as we speak, the pandemic is still around, is with us, it's not gone, and people are still dying with the pandemic, though not in large numbers as compared to some time back. This is the immunization coverage, and this is the dashboard that we use for all the people that have been vaccinated for COVID in the entire country. And as you can see, we have the region, the sexes that were vaccinated, male and female, and the total number of people that are vaccinated. In absolute figures, so far as a country, we had vaccinated 627,500 people of the COVID vaccines. But nationally, when we convert this percentage into coverages, we only had vaccinated 18%, meaning those that had completed their primary series of all the type of the COVID vaccines we are given, having the complete doses as per requirement. And out of that too, we had targeted priority groups since COVID started, and still we are targeting these same groups, and those are the people that are 65 years above, people with comorbidities, the hypertensive, the asthmatic, the diabetic, they are considered as the people with comorbidities. And we also have health workers, and of course, yes, health workers will not be left behind, looking at our role when it also comes to the disease. We had the security personnel, the teachers, and persons age 12 and above. So you can see the percentages of these priority groups I've mentioned that have been vaccinated so far countrywide. And today, I know we're here for another round, the 9th round of the massive COVID vaccination campaign, and it will take place on the 1st of March to the 10th nationwide, and we are targeting all regions. So simultaneously, all regions will be doing this campaign the same time, and we would all start the same day. So persons, like I said, we are not forgetting people with the priority groups, of course, would still be considered. With, I said, people living with comorbidities, like I said earlier, the hypertensive, the diabetic, people with. We will also have outreaches or mobile teams visiting communities, institutions, town centers, markets, anywhere that is a public place. Of course, we will have a team there, and there will be also people in communities moving from house to house just to see that people are vaccinated and the vaccines are gotten closer to their doorsteps. We also have in political rallies or gathering, normally we would send vaccines. Had some negative social media influence. Gando in his speech had made mention of some of the rumors, some of the misconceptions that we have had about COVID, and we're still hearing about COVID. And I obviously know that by now we know some of those rumors, like if you are vaccinated, you attack a phone, it attacks on your hand, or you would turn to a chicken. I have been vaccinated, but I am still alive, and I did not see anyone that had turned to a chicken after being vaccinated. So these are all rumors, obviously, we all know are not something true. And we also had, some misinformation too, that people go about spreading about the disease just intentionally. They will just come and say anything that they feel like about the disease, when actually it's not factual. Next slide, please. But the reason why the media personnel are called here, what are your stands? What is the role of the media personnel? And it's obviously the main reason you are called upon here to tell you, we want you to create awareness through your media platforms. for the Ministry of Health, and also the EPI unit especially. To also mobilize family members, school children, your colleagues, and also your community people.
You understand? The misinformation is just too much. You understand? People saying if you take a vaccine, you will not be able to have a child. These are unfounded, unfactual misinformations. We have colleagues who work with us and who were vaccinated the same time with us, and then they are having children. So help us to get to this 80% that is yet to be vaccinated, so that we can improve our coverage and get 70% of our population vaccinated. So on that note now, I think we will do questions and answer session. If you have any question, during countrywide, we have many strategies as far as communication is concerned. And in the presentation, Bayang made mention of one, which is using of religious leaders. In the provinces, these are people that are highly respected in our communities, especially in rural Gambia. So the imams, and not only the imams, but we also use what we call the communication, traditional communicators. These are Kanyelengs, these are women groups that are known to, sensitizing their communities. So during the arrival of the COVID-19 vaccines, we reached out to these communities. We did orient imams, we did orient alcaldes, we did orient chiefs, and still we will be continuing with those strategies, because these are people who are highly respected in their communities. And then when we give them the information, the importance of taking the vaccine and what the vaccine taking it can help to achieve. So these messages will be given to these people through orientation, and we even give them sometimes some token to go back to their people and also conduct step-down trainings with the imams doing it on their Friday sermons. These traditional communicators or Kanyelengs will be going around in weddings, in naming ceremonies, and then they will be spreading. On top of that also, we have community radios, and we have health workers in these regions, in these, some of them villages. So they will be engaging those radios to ensure that they have a weekly radio program telling the people on the ground that it is important for them to get vaccinated and why they should be vaccinated, because this will not only prevent them from catching the virus, but it will prevent them, if you catch the virus, from hospitalization and eventually death. So we have a host of communication strategies that we are using as far as convincing the people is concerned about the uptake of the vaccine. But as you know, the social media is a big challenge. So some of their relatives from Combo or Europe even might be sending them audios which are misleading. So we also tackle all those social media information, because we have a very active social media page, which is the Ministry of Health, which I know you must be aware with. So we also demystify these misinformations on our page, so to give accurate information also on social media. And we also have messages that we develop in audio. Sometimes we share on social media platforms like WhatsApp, and then attach photos and stuff like that. So there is a lot of communication that is going around this. And then with your help now, the media, I think that will help us to reach those that we are not yet reached by our own communication. So that's why we said the role of the media here is very important, because it's not just when people are dying that TV should be inviting me to come and talk about COVID-19. And this is the situation. When people were dying, people were getting sick, sometimes I get 10 invitations from TVs to come and talk about COVID-19. But when cases went down, death went down, hospitalization went down, TVs, radios are not calling or are not having us invited on programs to talk about vaccination, uptake of vaccination. And that's why your presence here is very important, for you to help us through your institutions to also add to that sensitization by creating platforms that will help us to come and demystify these informations and help the people to give them the facts that will help us to get them vaccinated. So thank you.